Hi, welcome to the session on postpartum care and recovery. This session is completely dedicated to the care and recovery of the mother, physical as well as emotional. The first 40 days after delivery bring in a lot of questions and concerns. What to eat, how to exercise, how much rest should I take, am I more prone to infections, how do I lose weight? There are lots and lots of questions that a new mother has, and there is lots and lots of advice that a new mother also gets. That is what we have dedicated this particular session to. We will hope to cover all your doubts, queries, and concerns so that this is the one place that you have to access for all your postpartum related questions, concerns, and doubts. Come, let's take a look at some of the important aspects of the postpartum period and how you can take care of yourself and enjoy this period. The first area that most new mothers will look at is their abdomen. When you deliver, you expect that because the baby has now left and is in your arms, your stomach is going to start looking very much like your pre-pregnancy stomach. As you can see in this picture, this is what your stomach can expect to look like. You will look approximately 7 months pregnant on the day that you deliver. Your stomach will also be loose and flabby and a little floppy. You may experience some abdominal cramps, which is absolutely normal. The concern here is that a lot of new mothers are told that, oh, there appears to be another baby in there, or that they were flat but new mother is not. These things will disturb a mother and she might start undertaking exercises which are not really safe or recommended at this point of time. Your abdomen is going to take approximately 40 days, that is 6 weeks, to settle down. Think about it like this. The uterus took 9 months to grow from its original size, that of a little fist, to accommodating the entire baby. So naturally, for it to go back to its pre-pregnancy size, shape and position, it is going to take a while. And that is the first reason behind the 40 days. 6 weeks is the time period that we are looking at. So don't worry, your stomach is going to look very much like your pre-pregnancy stomach really soon. Another thing that we have to concern ourselves with is stitch care in the vaginal area. As you know, to have a vaginal birth, most doctors will perform what is called an episiotomy. To recap, an episiotomy is a little cut which is made in the perineum. This cut is then sutured after the baby is born. Naturally, because you have a stitch over there, you need to take care of this, else it will get infected. Keep these few points in mind. Every time that you visit the washroom, try and wash your stitches with warm water. And when I say every time, it is every time you pass urine or you pass motions. Then you must pat dry this area. Naturally, this increases your toileting time, but don't worry, this is very essential to help you take care of your stitches. Your doctor will prescribe an anti-infective ointment. You must apply this every time you use the bathroom. Remember to wear loose cotton underpants, as this will allow the area to breathe. Cotton sanitary pads are also recommended. If you use the dry weave ones, the area will not be allowed to breathe well. If it is possible, leave your bottom exposed to air for some time, as this will allow the stitches to heal much better. And last but not the least, if you have the facility, please do soak your bottom in warm water for a few minutes every day. Stitches generally take anywhere between 10 to 15 days to heal, and these are self-dissolving stitches, so you don't need to go to the doctor to get them removed again. However, your doctor will call you at a 15-day mark post the vaginal birth to see and check your stitches. If your stitches get infected, they will become painful. and if you experience pain, you must let your doctor know. For the first 10 to 15 days, since you have stitches in the vaginal area, avoid any excessive exercise. Running, jogging, stair climbing are all not recommended. Try and avoid crossing your legs and sitting, as this will also constrict the area. Taking care of your stitches will make your postpartum recovery much more comfortable. If you have had a cesarean section, this is the kind of care that you have to take of yourself in the first 24 hours. Your doctor will instruct you to try and avoid movements for the first 24 hours. In fact, it is recommended that you lie completely flat on your back and even avoid using a pillow. If the baby needs to be fed, somebody can help you and hold the baby over you. You will have a catheter inserted for urination, as you will not be allowed to use the bathroom, and an IV will be attached for nutrition. You will not be given any oral intake by mouth, not even water, preferably for the first 12 hours. Your doctor will be giving you painkillers through the IV, and hence that will make you feel really comfortable. However, don't be deceived. This comfort is temporary. You have had a major abdominal surgery and you should not take it lightly. Make sure that you listen to all the doctor's instructions and not play with your body. Once the 24-hour mark is completed, the catheter is removed and now you are encouraged to use the bathroom and move around. Moving around, however slowly, is really important, because this is what is going to help your stitches to heal better. Your IV is also removed and a liquid diet is started. You might get rice water, clear vegetable soup, and maybe some dal water. You may have the sensation of passing bowels. Once you pass motions, your normal diet is started. The dressing over your stitches is changed and the nurse will help you to take a bath. Please make sure that you take the nurse's help, as this is going to be a difficult time for you. Your painkiller dose is also reduced, so you might start feeling some aches and pains and some twinges and pulls and tugs in your lower abdomen. Post 48 hours in a cesarean section, you will be on oral painkillers only. The dressing stays in place. However, this dressing is waterproof, so you don't really need to worry about wetting it. Movements are allowed, although they might be really slow. You might feel that you are just like an old woman walking around. Your normal diet can be followed now, and there are no restrictions to your diet post a cesarean section. You are allowed to eat pretty much everything as per your normal interests. Whether a vaginal birth or a cesarean section, lotier flow is very common to both. What is lotier flow? It's also called postpartum bleeding. This is not your menstrual cycle. However, this is common after a birth. What has happened? The placenta has implanted into the uterine wall during pregnancy. Once the baby is born, the placenta also gets delivered. The site where the placenta was implanted is now open and it is just like a wound which is bleeding. Also, to protect the baby, a very thick, lush lining was made. This uterine lining is no longer necessary and is now being shed. Lotier flow can last from 15 to 40 days. In a cesarean section, it's generally much lighter since the uterus has been cleaned well after the birth. In a vaginal birth, it could last much longer and it could be heavier. What is seen is that in the first 3 days, lotia is heavy and bright red. In the next 3 to 10 days, it will feel just like your normal period. Thereafter, you will experience mild spotting, and this can last anywhere up to 40 days post-delivery. We have seen that excessive activity increases bleeding. Therefore, it's important to listen to your body and rest. Now do you understand? why your mother and mother-in-law want you to rest post-delivery? Because of the Lothier flow. If we bleed excessively, we are losing body blood, and blood loss can result in anemia, low blood pressure, weakness, etc. It's not that I don't want you to move around, but what I need you to do is only what is necessary for you and your baby. A few more things to remember while the Lothier flow is in progress. Remember, there is a wound inside where the placenta has detached. Therefore, we will avoid inserting anything into the vagina during this period, as this can increase the chances of infection. I am referring to the use of tampons or intercourse. If you pass large clots or you have foul-smelling discharge, report to your doctor immediately. These are signs of an infection. Your normal menstrual cycle may return in the second month postpartum or when you stop breastfeeding. A lot of times I've had women call me and ask me this question. It's been 8 months since I delivered and I still haven't got my periods. Is that fine? And yes, it is absolutely fine. You may choose to tie an abdominal belt post-delivery. In a vaginal birth, you can tie this belt immediately. In a cesarean section, you will tie the abdominal belt only after getting permission from the doctor. The market, however, does sell special cesarean section belts, and these belts can be used to support the incision for the first few weeks. The reason why we tie the abdominal belt is to help to bring the rectus abdominis muscles together. They are not going to result in a flatter stomach, but they will allow your stomach muscles to come back to their original shape just a little bit faster. What this means is that wear as per your comfort. Traditionally in India, a cotton sari used to be tied. The reason for the cotton sari being better than the belt is because it can be tied from your rib cage all the way till your groin. And this makes it better since the rectus abdominis muscles stretch in this entire area. So go ahead and tie a belt or wear the traditional sari wrap as per your comfort for a few hours every day. Postpartum massage. Who hasn't heard about this? It is something which women look forward to because it's something which is done every day and it is also relaxing. Imagine if somebody were to give you a massage every single day for 40 days. It's fantastic. It's great for relaxation. It provides great private time for mom. But remember, it's not meant for abdominal fat loss. If you're a person who loves massage, then go ahead and book your masseuse lady right away. Make sure that she doesn't press too hard, doesn't make you feel pain, and definitely in postpartum massage, avoid massage of the breasts. This is something which is not recommended for the mother by any outsider. The baby is now feeding from the mother. During pregnancy, the baby was also feeding from the mother. What it means is that you as a postpartum mother need to take care of your diet yet. The first thing to remember is eat a balanced diet. Eat something from every food group in this pyramid. Carbohydrates, which are your grains, that is your cereals, your rice, your breads, your rotis. Eat your fruits and vegetables. You do not need to avoid any fruits and vegetables during the postpartum period. Make sure you eat your protein foods, your pulses, your chicken. This is not going to cause any heaviness, bloatedness, or any problems for the baby. Ensure that you have your dairy products. A point to remember here is that more milk does not make more milk. However, milk gives you calcium, so you need to make sure that you have enough calcium in your diet as well. Avoid high sugar and high fat foods. This is highly recommended. In our culture, we are traditionally bound to eat ghee and a lot of sugar-laden laddus. These are not recommended. The ingredients of these laddus are great though, so if you want to make a porridge out of them, that's perfectly fine. As a breastfeeding mother, you will feel hungry. So you must eat regularly, maybe every 2 hours. Drink plenty of fluids. I always tell my breastfeeding moms this. Breast milk is primarily water, so the more water you drink, the more breast milk you will end up making. Don't forget to take your prenatal vitamins. The prenatal vitamins will help to keep your nutrient levels at a normal pace. So make sure you take the same vitamins at least till you are exclusively breastfeeding. Remember, during pregnancy, the baby was inside you and feeding through the placenta. Now the baby is outside you but feeding through the breast milk. It's the same situation. Postpartum exercise is also something which is probably on your mind. When can I start exercising is $1 million question. I think the simplest answer to this is when you feel ready. Don't be pressured. Do as per your comfort level. As per normal recommendations, in a vaginal birth, you can start exercising after 40 days. In a cesarean section, you must wait for your doctor's permission. Always start slow. I understand you were probably doing 50, 70, 100 reps of a particular exercise when you were not pregnant. The postpartum period is not a time to be adventurous. You are going to be having sleepless nights, you are taking care of the baby, and you are breastfeeding. So remember to listen to your body. The safest thing that you could start with is a walking routine. Gradual weight loss is best. We do not look at the weighing scale for postpartum mothers. Weight loss, which goes very rapidly in the postpartum period, will surely affect your breast milk supply. Contraception? You are probably smiling. What a question to ask of a mum who is currently pregnant. And the question that I'm asking here is, when do you think is the right time to plan your next baby? And the answer is, the ideal time from delivery to your next conception is 18 months. Because this is the amount of time that your body needs to recover and get back to its pre-pregnancy situation as far as nutrient levels are concerned. If you get pregnant really early, then this is going to compromise your body and it will compromise the coming baby. Also, you will be asked to stop breastfeeding. So that's not really fun. You don't want to compromise yourself, your current baby, as well as your future baby. It's a good idea to plan contraception during pregnancy itself. Right now, when you visit the doctor, you probably don't have much to talk about. But contraception could be discussed. And once you have the information from the doctor, you and your husband can discuss what works best for you. Remember, it is possible to get pregnant even without getting your first period because ovulation can happen. While you're breastfeeding, it is best to avoid hormonal contraceptives. These will interfere with breastfeeding and definitely lower your milk supply, whatever is listed on the packaging. Condoms are only 80% effective, and for the first 18 months, I wouldn't rely on it. Of course, I would like to add to this that this would be reflected on your particular age and situation. If you are already past the ideal childbearing age, which is 35 years of age, and are having your first baby, then you might want to plan your second one a little faster. So do discuss this with your doctor and make the choice which is ideal for you and your family. A few more tips, whether a vaginal birth or a cesarean section. Avoid lifting heavy weights. This is not recommended as your uterus is still trying to shrink and go back into the pelvic cavity. Avoid driving. Why am I saying avoid driving? You have stitches in your vagina or you have stitches in your lower abdomen which are causing twinges of pain. Suddenly while driving, if you feel a twinge of pain, you could put yourself at risk. Avoid bending. Your uterus is still shrinking, so we do not want to cause any kind of disturbance in the abdominal area. Avoid stress. Stress is going to tire you out further and it is also going to reduce your milk supply. So make sure that you stay away from any kind of stress or worries or concerns. Leave that to people around you. It's no fun to be a stressed out mother. It definitely affects the baby as well. Interestingly, what we have seen is that if the mom is stressed, the baby seems to be stressed as well. So, what generally happens is that babies of moms who are stressed tend to be more cranky, more irritable, they don't sleep as well. Now, it's your choice. Would you rather have a baby like that? Or would you have a baby who feeds well, sleeps well, and is generally a very happy, likable, and lovable baby? You've probably heard about this from your friends, the postpartum baby blues. Why does it happen? Obviously, the first answer is hormonal changes. There are hormones which allow you to get pregnant, hormones which support your pregnancy, hormones which cause labor to start, and hormones which initiate breastfeeding. All these hormones are doing a merry dance in your body, and that causes you to feel a little bit blue and causes your postpartum baby blues. There's a lifestyle change. Right now, you're independent. If you want to leave the house, you can leave at the drop of a hat without planning. But once the baby comes in, you are going to have to plan, plan, and plan. If you're a working mom, it could mean job changes, responsibility shifts, maybe even loss of your job. So, there's a huge lifestyle change. The shift of attention. During pregnancy, you were the queen. Everybody was asking after your health. But right now, everybody is asking about the baby. So most mothers start feeling a little left out. Over and above that, you have the complete responsibility of the newborn. And this probably scares a lot of mothers a lot. Here are some of the signs of postpartum depression that you should watch out for. If you find yourself crying suddenly for no rhyme or reason, and you cannot explain and you can't bring yourself to stop. If you feel detached from everybody, you feel absolutely uninvolved, you have a don't care attitude for everyone around you. If you find yourself unable to care for the baby, if you find yourself upset with the baby. Sometimes a mother with postpartum blues or depression might report loss of appetite and also sometimes excessive appetite. Please do ask your partner and your family members to keep an eye open for these signs because it's really important that they are caught early and they don't convert into real, true postpartum depression. Postpartum depression is something that has to be dealt with. The first step is, of course, identifying the signs. If you're feeling upset or you're feeling blue or low or are experiencing any of these signs, it is important that you talk to your partner. Sometimes just talking to a family member, letting go of a few responsibilities and getting some reassurance can really help. If that doesn't work, make sure that you seek some professional help. There's no harm. We're not saying that you are a psycho or you need psychiatric treatment. You just need some help in getting through these dramatic changes in your life. Mothers are also advised to find some me time, and that's where those massages come into play. I think that's what used to happen in the olden days because mums had to be given some me time. Today's mothers can find other me time. Meet your friends. Maybe you could go out for a cup of coffee, go for a walk, watch a movie at home, call for some food from outside, whatever works for you. It's good to meet people. And better still, it's good to meet other moms. You might want to join up some support groups. You might want to go to places where there are new mothers. A lot of places run new mommy programs now, especially in the metro cities. And that is a great forum to exchange information about what you're feeling. When you see that there are many other mothers going through the same feelings, it doesn't feel so bad. Also, don't try to be a superwoman. Don't try to do everything yourself. If your mother-in-law wants to help, sure. If your husband wants to do something, great. If you have a maid, delegate. I know it may not be perfect. I know it may not be the way you want it to be. But it's really essential that you find time for yourself and allow other people to do stuff as well. They love the baby too, and that's really important. Remember to find time to spend with your partner. At the moment, when there is no baby, you're a couple. You do a lot of things together. You connect, you laugh, you go out, you watch movies, you have dinner together. You are solely for each other. When the baby comes in, this equation is going to be disturbed. Many times, partners feel left out. You might feel neglected, your partner might feel, oh, out in the cold just because you are all the time with the baby. Find time to spend with each other, find time to do things together. I'm sure you can find somebody to take care of the baby for just an hour while you step out for a walk with your husband, or go down to the local coffee shop and have a coffee together and come back. Or maybe just do stuff with the baby together. It's not necessary that the husband has to be left out just because the mom is all the time breastfeeding. Dads, there are lots of things that you can do. You could burp, you could massage the baby, you could play with the baby, you could do some helping chores around the house. Anything to make the mother feel happy and wanted. So as you can see, the postpartum period is a period of tremendous change. It's a dramatic shift in your lifestyle, and there are lots of physical changes as well. However, it's a short period. It's generally considered the first 6 weeks after delivery. Things are definitely going to change thereafter. You will become a professional at handling your baby, your hormones will settle down, you will realize that life is great and it's a lot of good fun to have a new family member. After all, that's what we do, right? We have babies so that we can take our generations forward. And that's just what we are doing. Just the first few weeks can be a little difficult, but with the right help and the right support, and of course the right information, you can get through this period. If you have any questions about the postpartum period, even after you deliver, please do write into mybabyquery@gmail.com. mybabyquery@gmail.com. I'm sure you enjoyed this session, and we look forward to helping you with many more bits of information as you enter this journey of parenthood. Thank you.